I'm just going to assess your respiratory system today. I can see that your posture is upright, you're in no distress, there's no nasal flaring, your skin is warm and dry. If you want to just hold up your two thumbs and hold them face to face, very good. I can see there's a 160-degree angle, which is no signs of clubbing. I'm just going to take a peek at your conjunctiva, and it's nice and pink, indication of no anemia. Your trachea is midline, and your nails and your capillary refill is instant, and they're nice and pink, which is good circulation. Your chest looks normal. Your anterior and posterior is 2 to 1, which is normal. I'm going to have you turn around. I'm going to palpate your back, and I'm going to feel for any crepitus or any tumors or any masses. Is it tender at all when I palpate?
No.
Anything hurt?
No.
Okay, good. And then I'm going to check your thoracic expansion. So I'm going to be around T10 on both sides of your spine. And have you take a deep breath in and out. So that's equal movement, so your thoracic expansion is normal. I'm going to check for tactile. I'm just going to have you turn around and do some palpation on your back. And each time you feel my hands move, I'm going to have you say the number 99. I'm going to start at the apex.
99, 99, 99, 99.
Very good. For your apex to the base of your lungs, the tactile firmness decreases, and that is normal. I'm going to check for percussion on your back and have you give yourself a big bear hug. And I'm just going to percuss from your apex to the bottom of your lung and checking for resonance. Very good. So there's resonance throughout, and I'm going to check anteriorly as well. If you could turn right around. Thank you. Very good. So resonance throughout anteriorly as well. Now I'm going to have you turn around again, and we're going to check for a diaphragmatic excursion. I'm going to have you take a nice deep breath in and let the air all the way out and hold your exhale. So I'm just going to percuss from the apex till I feel some dullness. Very good. So it's about right here. I'm just going to put a piece of tape in that area. And now I'm going to have you take a deep breath in and hold it. So I'm going to start the piece of tape and percuss till I feel dullness. Very good. So right about there. And then I'm going to measure it. And it's about 4 centimeters, which the normal is between 3 and 5. I'm going to also take posterior, anterior, and lateral. I'm going to have you take some nice deep breaths in and out through your mouth. And if you feel lightheaded or dizzy at any time, please let me know. So listen over your lungs. In and out. In and out. Very good. And I'll have you turn around. We'll do it anteriorly. In and out. And lateral. Very good. I'm just going to listen over your manubrium to listen for any bronchial sounds. And that's quite loud, and over your tracheal as well. Deep breath. Oh, it's very loud. So now we're going to assess your cardiac system, and I'm just going to point out the places where we can listen to heart sounds. So this is your suprasternal notch, and then this is your clavicle, and then about an inch down is your second intercostal space. The first rib is kind of hidden underneath the clavicle, so we're not able to palpate that. So you'll come down about an inch to the second intercostal space, and this is the area where you would find your aortic sound. And then to the left of the sternal border, second intercostal space, is your pulmonic sounds. And then we move down to the left of the sternal border, the third intercostal space, which is your Erb's point. And then at the fourth intercostal space, we have your, on the left side of the sternocleidomastoid is your tricuspid area. And then your fifth intercostal space at the left of the sternocleidomastoid is your mitral or apical area. To your heart sounds in those 5 areas, using my diaphragm, which listens for high-pitched sounds. Say aortic, pulmonic, herbs, tricuspid, and mitral. Very good. And now I'm going to listen to them using my bell on my stethoscope to listen for any low-pitched sounds. Pulmonic, herbs, tricuspid, and mitral. So what I found is the S2 is louder in the aortic and the pulmonic, and the S1 is louder in the mitral and the tricuspid. And when I used my bell, the S2 dub is louder. And the Erbs point, the S1 and the S2 are equal. And then the S4 lub is louder using the bell. And then the apical and mitral lub is louder. So there's no S3 or S4 murmur heard. Stop. Now that I have you laying down, I'm just going to inspect for any pulsations, any heaving, or any distension in your mitral, your jugular, and in your aortic. So visually, I'm not seeing any pulsations from your jugular. I'm not seeing any heaving or lifting from your aortic area, and I do feel a pulse down by your mitral, but it's not. There's no distension noted there. I'm just going to shine a light over your jugular vein to note for any distension, and I'm not seeing anything. It looks normal. Then I'm just going to palpate your aortic, pulmonic, herbs, tricuspid, and mitral areas, and then I'm going to feel for vibration in those areas as well. Aortic, pulmonic, herbs, tricuspid, and mitral. And there's no vibration felt up there at all. So there's no turbulent blood flow, and there's no depiction of any murmur. Left lateral position, and I'm going to check for any S3 or S4 murmurs by listening over your aortic and pulmonic areas, which are best heard in this position. Using my bell and my diaphragm. Diaphragm first. This is the aortic. And pulmonic. And then using the bell, aortic, pulmonic. And there are no murmurs heard in the aortic or pulmonic S3, S4 area. Now that you're sitting up, I'm going to have you lean forward. I'm going to listen for any aortic or pulmonic murmurs when you're leaning forward, as that this position does bring those out a little bit better. So I'm going to listen with my bell on my diaphragm first. And then the pulmonic area. And then with the bell in the aortic area. And then the pulmonic area. And there's no evidence of any murmurs in the aortic or pulmonic areas. The peripheral pulses, I'm going to start with the temporal pulse. We're going to check them bilaterally, and they're +2. I'm going to check your carotid pulses one at a time. +2. And +2. I'm going to check your brachial pulse. Just have your arm extended. And that is +2. I'm going to check your popliteal pulse in the back of your knee. and that's +2. Your dorsalis pedis pulse is +2, and your posterior tibial is +2. And then I'm going to check an Allen's test on your arm, just to check for circulation. I'm going to occlude the radial and the ulnar arteries, and I'm going to have you make a fist. And then I'm going to have you open your fist, and then I'm going to let go of the ulnar artery, and there's nice pink flow, which is good circulation. There's a positive Allen test. Your brachial pulse with your arm extended, and then I'm going to move to your radial pulse and your ulnar pulse, which are all +2. So now it's going to listen to your apical pulse for 1 minute. '76, and take your blood pressures in both arms. (120/66). And 120/56. Thank you. So I see that you're not having any intercostal retractions, and that's great. And I'm just going to check your respiratory rate for a full minute. And that's within normal limits. Your breathing is nice and easy. Your skin is warm and dry to touch. There's no edema noted. Your hair is evenly distributed throughout your leg.